Okay. Just give me a thumbs up. Hello, everyone. My name is Tina Brock, and I'm the course director for the Monash Pharmacy course. I'm going to pause just one more moment to make sure that everyone has a chance to join the live session. We'll be on in just a minute. So first, I'd like to acknowledge the people of the Kulin Nations on whose land we are gathered today. I pay my respects to their elders past, present, and emerging. With online sessions, people may be based elsewhere, so I pay my respects to the traditional owners of the land from wherever you may be joining us. So 2020, what a year. Total crap, would not recommend. Not at all the way you probably imagine spending your last year of school. But on the other hand, 2020, what a year of opportunities. Some great things that we've learned in healthcare and in education that have absolutely transformed our future. Because uncertainty is actually part of healthcare. If you're a doctor, a nurse, a pharmacist, a physio, another member of the allied health team, then every day you're dealing with probably a little less information that you need to make decisions. And so one of the really strong things that we teach in the Monash Health courses is how to deal with that uncertainty, that ambiguity. And this has been a strong part of our course for several years, and we've definitely used it a lot this year. This is the billboard outside of our building right now. It's thanking pharmacists on the front line against COVID-19. And this is really important because pharmacists all over the world are stepping up and taking care of patients in new ways and better ways and really becoming gatekeepers in the healthcare system. You'll see that internationally, the International Pharmaceutical Federation is actually recognizing the new and improved roles that pharmacists are playing. It's really important. I was talking to my husband about healthcare and what's going on in healthcare right now. I said, you have to be aware that pharmacists have still been working every day. In some cases, they're working even more hours and doing new things. So let me tell you a little bit about that. First of all, pharmacies have remained open all over the world as essential services. Now, what does essential services mean? That means the government has determined that what we do is so important that it would be harmful to the public if we were to close. And so what you see is more pharmacies are doing more shifts, expanded services, and I'll talk a bit more about those. In the hospital situation, many of our hospitals have gone to 24-hour coverage, which means they need even more pharmacists to help out with those services. And we don't see this changing. In some cases, this has put pharmacists on even more patient care teams than they have been in the past. And we expect that that will continue. And there's some new things that pharmacists are doing as well. In this large photo here, this is a picture from Seattle, Washington in the US. And it is actually the first person getting the first vaccine for COVID-19 in the whole world. So this is part of a clinical trial that's testing this specific vaccine. And what's really interesting about it is the person administering the vaccine is actually a pharmacist. So we imagine that as these vaccines come to market and need to be given all over the world to everyone, pharmacists will play a very active role in that. In the top photo, you'll see a pharmacist doing what's called a home medicines review. So these are pharmacists that are accredited to provide specific care in the home with patients. And even though we may have to do that with a mask and at a slight distance, the government has determined this is so important, these should continue. When it's not safe to provide services directly in the community, we also have telehealth style consultations. And this has become something that's really important. Previously, we would have thought, oh, telehealth is coming, a year, 2 years, 5 years along the way. And we've been able to show this year that telehealth is here and it's here to stay. And pharmacists are an active part of that. But let me tell you a little bit about pharmacy. What is pharmacy and why does it matter? Pharmacy is a health profession. That may go without saying, but I like to really emphasize that pharmacists are the medicines experts on the healthcare team. We like to say that healthcare is a team sport. It takes all members of the healthcare team, your doctors, your nurses, your physios, your pharmacists, allied health professionals, working together with the patient to get the best outcome. And because most of the health problems in the world actually require medicines for treatment or prevention, it means that pharmacists are very important. The knowledge and the skill that we provide are absolutely critical for that. Some of you may think of medicines as the medicines you have most commonly taken, like tablets or capsules or injections, eye drops, inhalers, or creams. But there are amazing new dosage forms out there. We call them health technologies that are regulated just like medicine. And one of these is actually a video game that's been prescribed as a treatment for a certain type of condition in adolescence. And so there's things like wearables that monitor your how well your heart is beating and how well you're breathing and things like that. These are the exciting future of what medicines mean, and pharmacists will be part of that as well. This slide shows just a few of the many opportunities, career pathways for pharmacists. And we call pharmacy a degree of opportunity because foundationally, knowing about medicines and the role medicines play in healthcare really opens lots of career paths for you. The most commonly known are community pharmacy and hospital pharmacy. And however, there are pharmacists in the pharmaceutical industry, pharmacists who are doing those medicine tests, clinical trials to see how medicines are best used in human beings. You can work in a non-governmental organization. You can work for the government. You can prepare and manufacture medicines through extemporaneous compounding. I really like this slide because I've been a pharmacist for 30 years and I've actually done every one of the jobs on this slide. And this is just a few of them. If you go to our graduate outcomes booth, you can actually download add to your swag bag, a really great brochure that I think describes about 22 different career pathways for pharmacists. The most important thing you can remember is anywhere there's a medicine, there's a pharmacist. And the thing that ties all these pathways together are the opportunity to make tomorrow better. I often talk to students who say, why would you like to study pharmacy? And they say, I like to help people. And pharmacists help people through medicine's pathways. And whether that's discovering new drugs, like some of the staff here at Monash, that's Natalie Travascus, Sab Ventura, or whether it's helping patients use medicines better, like Simon Bell, who helps us design simpler regimens for older patients. Whether it's directly providing patient care to patients with breathing diseases, young patients, or even writing a novel about medicines use, all of those are ways that pharmacists make tomorrow better. So how does the Monash Pharmacy course set you up for your future? Let's see. Well, the first way is if you join us here at the Parkville campus, the beautiful Parkville campus located surrounded totally by parks, which I think is pretty great no matter what. It's a standalone campus that's perfect just for pharmacy and pharmaceutical sciences, but it's right down the road from the biotech precinct and right up the road from a thriving, bustling, great restaurants, fun coffee shops. It's a really close-knit community where we know each other by name and we look out for each other. And I think it's a really, really cool place to study to be a pharmacist. And when we're on campus teaching in our space, in our learning spaces, this is what it looks like. A lot of small group, hands-on work. We do a lot of workshops and laboratories. We work together with other pharmacy students. We also work together with medical students and nursing students. And it's a really active, energized, buzzing type of learning situation. More recently, in 2020, we've been doing a lot of our learning online. And I have to say, we have been able to really keep that same degree of energy and buzz and engagement and connecting our students with each other, as well as students in other health professions in the online spaces. So much so that the program here, the Monash Pharmacy program, has become well known all over the world for what we call our pandemic response. So the teachers here have been part of international webinars all over the world sharing how we're doing this. And we've had our staff have been interviewed locally about their research work, like a tremendous vaccine that's some research going on here, as well as the teaching that we're doing all over the world, helping patients understand more about medicines and how they should best be used or maybe not so used. So, absolutely world-class activity going on. Even more exciting is what our students have been doing during this time. Our students have been actively involved. They've been out on placements. They've been working in community pharmacies. They've been working in hospitals. They're leading the professional organizations all over Australia. They're competing in great competitions and doing well. Our People's Choice Pharmacy Student of the Year, collaborating with other health professionals on vaccine campaigns, and really talking widely with pharmacy students all over the world about their experience. And it's truly, our students are a great asset for our program. And I really encourage you to go to the booths and meet them and talk with them about what it's like to be a pharmacy student here. So could you be a good fit for pharmacy? Let me tell you about what we look for in our pharmacy graduates. We want our graduates to be distinguished by the way they approach challenges. Challenges just like, how do you go to school during a global pandemic? The way they communicate inclusively and include, they really respect and value diversity. They collaborate in teams. As I said, healthcare is a team sport, and it's important that our students develop and appreciate those skills as they go through our programs. We want our graduates to put patients first. Sometimes we have to do things that are inconvenient to us because we have to focus on what's most important for the patient. We know that everything that you need to learn to be a pharmacist is not going to be able to be taught to you in your undergraduate course. So you have to be able to reflect for continuous improvement. And we know some of you may think, may have been told, I'll be a great pharmacist because I'm good in chemistry or math or biology. But there's really a lot of different sciences that contribute to being a good pharmacist. And so for those of you that are interested in things like sociology or psychology, anthropology, epidemiology, economics, and technology, pharmacy is a great pathway for you as well. This is a really good example of what you can expect to be like if you come to study pharmacy at Monash. This is a tweet from a surgeon here in the Melbourne area who was talking recently. He was struggling to get the special kind of mask he needed to be able to perform his surgeries safely, in his opinion. And so a pharmacist, actually a Monash Pharmacy alumni, saw that this surgeon was struggling, sent him a letter and sent him the mask that he needed. He said, I want to do my part to help you and to make healthcare better. So I'm going to send you these masks. And I think that's what Monash pharmacy students and pharmacy graduates are very distinct in. They'll take action when action needs to be taken. Will this course provide you with the right opportunities to succeed? Well, let's see. We have world recognized quality. No matter which rankings that you're looking at, Monash Pharmacy is at the very top of those. And, we take that reputation very seriously. We feel that it's well earned, and we invest a lot of time in continuing to grow and develop in that space. One of the things that's really interesting about our course is in Australia, it takes 5 years to become a pharmacist, no matter what course you go to. So you do a 4-year undergraduate program, and then you do a paid internship. So no matter where you study pharmacy in Australia, it will take you 5 years. In the Monash program, during that 5th year, if you do some additional training on top of the internship, you can actually earn a master's degree at the same time. So in the same 5 years it takes you to become a pharmacist anywhere, at Monash you earn both a bachelor's honors and a master's degree. So a same duration, but a higher qualification. This is what our year level units look like, and it's a lot of detail to be on one slide. I really encourage you to download our brochure, talk to our students. But one thing that you'll see is our units are actually connected. The staff work together to make a really nice journey for the students at each year level. And in the Monash Pharmacy course, you are absolutely assured that you will get access to every unit. You don't have to worry about, hey, I needed How the Body Works and I wasn't able to get into that unit. My graduation might be delayed. All pharmacy students take the same units every semester. We also start those placements early in the course and then extend to longer placements late in the course. So you get to do, you have some choice in what you do, but you're always assured that you'll get everything that you need. Here's the 4 things that across all Monash Pharmacy and Pharmaceutical Sciences courses we can assure you. Our staff believe in active learning, whether that's in our workshops, our laboratories, or even our online spaces. The students are part of the learning process. We focus on skills. So you'll see the 8 core skills at the bottom of the slide: problem solving, oral communication, written communication, empathy, reflective practice, integrity, teamwork, and inquiry. These are 21st century skills needed by all health providers. So they're very transferable no matter which area of pharmacy you choose to go into. Experiential learning, getting practice, getting feedback in the authentic practice spaces is critically important to us. So we start that experiential learning in year 1 and we continue to build and grow on it all the way through year 4. And finally, employability. We have some distinct features of our course. You get to do a research project. You have training, special training about leadership development and how to create a global mindset that really distinguish you in the workplace. We also have something that's very popular, which is each week of instruction in our course looks very similar. So we call it the DEAR model. We hold it dearly in our hearts. Every week, students rotate through discovery, and that's preparatory learning that you do on your own. Explore, these are interactive lectures or webinars where we take the information that you've learned on your own and we extend it and we answer your questions and we help get you ready for apply, hands-on workshops and laboratories where you actually get a chance to try things out. And finally, reflection. And this is an e-portfolio and a coach, and I'll tell you a little bit more about that. Now, whether we're teaching in the classroom or in the online space, we use the same model every week: discover, explore, apply, reflect. And our students really like that because that helps them to plan and predict across the entire semester. Again, I said it's on campus or online. We use very consistent ways of showing you and introducing you to different topics. You'll have some sessions that you'll have, your whole cohort, about 200 people online with you. You'll have some smaller group workshops, and you'll get to interact as well through polls and quizzes and games and lots of ways that we, lots of different active learning strategies. As I said before, we know that you can't learn to be a good pharmacist just by reading a book. You have to have a chance to practice in authentic healthcare settings. And so we get you out early and often, working with the very best practitioners in all of Australia. And this is my favorite part of the course. Athletes need coaches, musicians need coaches. Coaches help us get the feedback we need to adjust our behaviors and sometimes adjust our expectations for success. So every student in the Monash Pharmacy program works with an academic or a practitioner coach all the way through the course. So every year you get assigned a different coach who works with you individually and in small groups to help you be the best you. The top picture is a picture of my group, the Brock Bunch, and this is when we were on campus. You'll see we're nice and physically distant, keeping it safe. And below, this is the Brock Bunch online. Also, interacting, me giving them feedback about their skills development and helping them to become the best them. Monash Pharmacy is absolutely known for its simulations and the way we use technology. We know technology is a very important part of healthcare, and we bring those technologies into the classrooms for you. This program is called My Dispense, and it was a program invented and developed right here at Monash Parkville. And now we share this simulation with more than 160 pharmacy schools all over the world. So pharmacy students all over the world are using the tool that was developed right here at Monash for our pharmacy students. And we're really proud of that community and that connection. I know I've talked about a lot of different things, and you probably have some questions that I'm going to answer for you. But if you're still figuring things out, that's okay too. There's actually different ways to study pharmacy at Monash. The traditional entry pathway 1, is you join us right after school. You do your 4 years with us for your B-Pharm Ons. Should you choose to stay on with us for your master's component and internship, that's a paid internship in year 5. Some students may complete another science-based course in years 1 through 3, and then join us at year 3 to finish out their B-Pharm, M-Pharm with the internship. And some students may choose to start instruction at our Malaysia campus and transfer over at year 2 or year 3 to finish out with us. So there's a lot of different ways to study with us, and I really encourage you to go to the booth, talk with the entry requirements folks, talk with them about your specific situation, and get some advice about what the best pathway is for you. Oh, stole my own thunder. Go to that entry requirements booth, walk through this specifically. There's a live session at 5:30 today. Go to the student booth. Talk with our actual students about what it's really like to be a student. There's a great resource available you can add to your swag bag called Pharmacists in 2023, Roles and Remuneration. It talks with you about several career pathways and about what your earnings are predicted to be for each of those pathways. And really watch some of the videos that are linked into our booths right now that talk about different pharmacists, community pharmacy, hospital pharmacy, pharmaceutical industry, what our students are doing, what our teachers are doing, what we've been doing for the last 6 months. I think you'll find it pretty exciting. I did want to answer one question which almost always comes up, which is, what's the difference between pharmacy and pharmaceutical sciences? There is a lot of overlap. In fact, I'm a pharmacist and I have a master's in pharmaceutical sciences. Some of the folks that teach in pharmaceutical sciences are also pharmacists. Both careers deal with medicines and health technologies, but a real distinction comes at the course level. If you don't ever want to work in a lab, you can still study pharmaceutical sciences, but the course itself will have you spending a lot of time in the laboratory. If you don't want to be a patient care, if you don't want to work in a hospital or a community pharmacy directly with patients, you can be a pharmacist, but the course itself has a lot of time spent in healthcare settings. So although there's some overlap in what careers are available to you, the 3 to 5 years that you're part of our courses might be very specific. And I really encourage you to talk to our students and staff about that. So a little bit of a teaser about what it's like to be a pharmacist at Monash. I think both of these things are true. Some of the things about 2020 haven't really been that great, but in other ways, we've learned how much we can do together, how much we can contribute to the healthcare system, and how much better we can take care of patients with our pharmacy students, pharmacy graduates, and alumni. So whether you're here with us next year and we're online or wearing masks, whether you're right here on Parkville campus with us, I speak for my entire team when I'm saying we can't wait to see you. Join us to change it as a pharmacist with Monash. So let me answer a few questions. The first is, can pharmacists who study at Monash work overseas? The answer to that question is a little bit complicated. Yes, absolutely you can. Certain places that you might want to work have a language requirement. So if you don't speak the language, it wouldn't be possible for you to safely work as providing direct patient care. But you may be able to work, for example, in the pharmaceutical industry where perhaps the baseline language is English. Every country determines its own practice requirements, but our course has been benchmarked with the best courses available worldwide. So for example, we recently had a student who graduated from our program who's Canadian, went back to Canada, had no problem registering there. We have a lot of folks who go to Europe and other parts of Asia as well. So it's certainly possible. There may be some elements of registration that you'll need to pay careful attention to on the receiving end. How hard is it to get a job in a hospital? How long is a piece of string? Well, because the next step after graduation for pharmacists in Australia is an internship, we can tell you that about 70% of our graduates go into community pharmacy internships, and about 30% of them go into hospital-based internships. Some of that is based on the number of internships that are available. In Victoria, in this state, there's about 400 total internships, and about 100 of those are based in hospitals. But the best thing about a pharmacy degree is we have plenty of people who work in our hospitals who did community pharmacy internships, and folks who work in community pharmacy who did hospital internships. So while it's competitive, it's certainly something that I think that's approachable and accessible for most graduates. The question is, do you get a choice of internship type or location? Absolutely. The internship, while Monash University governs the learning, the formal units that become part of the internship, the site itself determines your employment. So you're actually employed by, say, Alfred Hospital or Chemist Warehouse as part of your internship. And those are managed, directly between the intern and the employer themselves. So you can choose wherever you like to do your internship and then work with us on the unit side. Is there much research or lab work in the course? Yes, it's a master's level course, and so all of our students do a research project as part of that. Not all research happens in labs though, so we have a lot of educational style, clinical style, epidemiology type research. So some of our students will choose to do a laboratory-based research, and all of our students will learn how to make medicines in small quantities as part of the course. So everybody will have a lab experience. Some students may choose a lab research project. Other students may choose, for example, to do their project at the Royal Melbourne Hospital, or we had some at Terry White Chem Mart. We had some students doing research with the Pharmaceutical Society of Australia. So we have lots of different opportunities for research within and outside the labs. Other questions? Okay, please hop on over to some of the booths, talk to our staff, talk to our students, let us know what your questions, and thank you.